Good evening. Thanks for joining us. It is now a public health emergency. Another confirmed case of coronavirus, this time in Massachusetts. And we are still waiting for test results on 2 students here in Ohio. Dorsina Drakeford joins us now to explain the real threat and what countries are doing to contain it. Hi, Dorsina.
Well, hey, Lena. Health officials are trying to spread knowledge right now with reports of possible infections coming in more often. And at this point in time, the concern here is still the flu. But the United States is taking the coronavirus very seriously.
Australia and Japan are joining the United States, putting travel restrictions on people and planes going to and from China.
Well, our first responsibility is Australians and Australia's national interest, and that means the health of Australians and their well-being, and that is what is driving our decisions.
It's part of the growing concern over the coronavirus, how it's spread, and how to stop it. Starting Sunday, the United States government will enact its strictest measures yet.
Foreign nationals, other than immediate family of U.S. citizens and permanent residents who have traveled in China within the last 14 days, will be denied entry into the United States.
The U.S. is also imposing a 14-day quarantine for those who have been to the epicenter in China. And for that, the Pentagon just announcing they have military housing they're providing for up to 1,000 people who have to be quarantined. In Boston, a University of Massachusetts student already separated from the public, diagnosed with the virus and being treated, while in New York City, one person being tested for it. Here in Northeast Ohio, results are not back yet for the Miami University students who showed symptoms of coronavirus. But according to health officials, we're still at relatively low risk.
But I want to emphasize that the risk to the American public currently is low.
This is not something that's being transmitted from person to person, place to place. This is not something you're seeing at the grocery store, at the movie theater, at ball games, or anything like that. This was close contact within the same household.
We do know in China, people are dying from the coronavirus, but as of now, no one in the U.S. has died from it, making the flu still a bigger threat for many healthcare professionals, Lena.
Very true. Thanks so much, Dorsina.